Hi, I'm Vanessa Emerson, founder of Dental Speakers Bureau and Dental Speaker Institute, and I'm here today with our colleague and friend, Dr. Ronni Brown. Hey, Ronni, welcome.
Hi, Vanessa. How are you?
I'm doing great. Thank you.
Good.
And thank you so much for being here. We're just pulling together this little impromptu video to be able to share with the industry an important message and an important workshop that I'd love to share with you. Now, I anticipate that many of you already know Ronni, Dr. Ronni Brown, might already know her because you have sat through a course of hers at a meeting somewhere along the line, or you have read her book, or you have seen her articles, or, she's all over the industry really as a foremost expert on meth mouth is a term that Ronni would use, but she helps audiences understand the impact of substance abuse on oral health and treatment outcomes. And Ronni has a new workshop that I really wanted to share with you and for you to consider participating with as a dental professional. The statistics are that 1 out of every 10 people experience addiction issues. So if we think about the number of, I just got goosebumps as I thought about that, that's a lot of people. So if you think about the number of people that have been through your practice this week, each of you, if you think about that, there's at least a handful of people that have either been challenged in the past with addiction or are currently experiencing substance abuse challenges. And that just seems like it's something that needs to be spoken about more frequently than we have been. And so I just wanted to invite you here, Ronni, to share a little bit more about the workshop that you're offering and what's that about? Why would a dental professional come to this workshop? What will they learn and how will it help them?
Thank you, Vanessa. A lot to unpack there.
Yeah.
So the workshop is called Breaking Bad and Breaking Through, Managing and Treating Patients with Meth Mouth. There's 2 spring options. One is March 5th and 6th, and the other is April 30th and May 1st. And these are 2-day workshops. They're virtual workshops with 12 CE units. But this is such an important topic. As you mentioned, Vanessa, 1 out of every 10 Americans has a substance use disorder. That means that as practitioners, we encounter these patients every single day and every single week in our practices. But the challenge is that, most dental professionals have never received training on how to manage this population, a very specialized population in the practice. And so when we do encounter them, and even when we recognize that these patients may have had some type of methamphetamine abuse, we get frustrated because we don't know why our treatment's failing. We don't even know how to approach treatment. And so I think that this course is going to answer so many questions and possibly ease the frustration that many practitioners have. They're going to learn how to first recognize what those physical, oral, and behavioral clues are associated with methamphetamine abuse. So they can begin to really identify who these patients are in their practice. They're going to learn how to lean in and have challenging conversations, but they're going to learn how to take challenging conversations and manage them with ease and confidence in a way that's not offensive or accusatory, but have conversations which will help to guide the treatment planning decisions that they're making. And then they're going to learn how to treatment plan, because the secret's not in the execution of the treatment, but it's planning the treatment with the understanding of how the use of the drug can determine treatment success or treatment failure.
Wow, that's a lot, and it feels so comprehensive. I love that because it feels like you take us from A to Z on this workshop. Can you tell me more? Is this virtual or in person, and what's the length?
It's a virtual workshop. It's taking place over 2 days, Friday and Saturday, once again, March 5th and 6th, April 30th, May 1st. And it is going to be a virtual workshop, but I have planned, Vanessa, that no one's going to be listening to me for 12 hours, right? Who wants to do that on their weekend? I have planned a very dynamic, a very interactive, a very engaging workshop where people are going to be able to address their own pain points and come to their own thoughts around many of the things that we're presenting. I've got a lot of activities built into the program, opportunities for us to share and even do case presentations. So there's going to be a lot of pieces to the puzzle that will create, I think, a real rich group experience.
Oh, that sounds fabulous. And so this is something that is over Zoom and we'll see each other. Is it a webinar or is it more of a workshop where we see each other and we participate? It's the latter.
It's definitely a workshop where there's going to be a high degree of participation and thought process and execution and role playing. Like there's going to be a whole piece where we're going to role play how to have these challenging conversations with patients and reflecting on what makes it so difficult. So there's going to be a lot of interactions. I want the participants to roll up their sleeves, dive deep, and experience a breakthrough.
I just love this. I love so much about this. You know, I'm working in healthcare for so many years, and I used to work in a general surgeon's office before I worked in dental. And I would say that there were times I wondered, but I felt like I didn't know what to say. And so what I really appreciate about what you're doing here is you're giving us a comprehensive solution. So I anticipate that many dental professionals have had that experience as well, where they felt like there's something that's just maybe not quite 100%
Yes.
feeling comfortable here, that we know what's going on, but we don't know what to say or how to say it. So
Right.
the idea of even the role playing in that safe environment of a small group virtual workshop, I think is going to be so amazing. It feels to me like once we go through this 2-day experience, that we'll be able to have the skills and the understanding and the knowledge and the resources. I'd love for you to tell us a little bit more about that, but to be able to put this into use on Monday.
Yeah, that's the whole point of it. You know, Vanessa, a lot of courses that are out there about substance abuse and addiction spend a lot of time with the fancy pharmacology, which of course is important because it kind of provides a foundation of what you'll see and what manifests for that patient. But at the end of the day, the attendee will walk away still not knowing what to do when they go into their office on Monday morning.
Mm-hmm.
My approach is to tell you not only what to do, what to say, but how to do it. And literally on Monday morning, you'll be ready. You'll be confident. You'll know exactly the steps that are necessary to recognize, communicate, and treat these patients. Participants are going to leave with a lot of resources: a health history form, office policy form, a meth maltreatment plan assessment form, a copy of my book, A State of Decay. So they're going to leave with a lot of resources, but not just resources. They'll know exactly how to utilize those resources.
That's amazing. And I've seen that assessment form. That is just makes such a complex topic very crystal clear and easy for the clinician to walk through and be able to get answers. That alone is worth the cost of admission. Seriously, that's fabulous. So much great information here. So speaking of the cost of admission, did I hear you say that before? I don't remember.
So the tuition cost is $700. However, I have a breakthrough promotion code, which will literally take off about 30% of the tuition costs. So they just have to enter breakthrough as a promotion code. And with 12 CE units, I think it's just going to be a fantastic, well-priced, good bang for your buck course.
Oh my goodness, yes. Yes. And one more thing before I tell them where to go to register. So it's 2 days, but do I remember right? It's broken up into chunks of time.
Yes. So it's we have like a 3 hour in the morning with a mid-morning break. We have a 2 hour lunch. And we come back and we have another 3 hours in the afternoon. And then a long relaxation before we start back the next day. So it is definitely broken into chunks. And once again, there's a lot of little modules because we want to make sure that we get people talking, we get that interaction, we have the opportunity to role play and do exercises. So it's going to be a jam-packed but fun, interactive session about a pretty difficult topic.
That's great. And with it being a small group, it feels like too, I've been to some of these type of meetings where you just walk away with new colleagues and like a really safe environment where you can talk and share. This is so awesome. So where do we go to register?
Okay, so you can go onto my website, which is drronnibrown.com, and there's no E in that. So it's DRRONNI Brown.com. And then on the upper tab, on the upper menu, It says seminars. And if you just click on that, you'll see a drop down menu. And the workshop, once again, is called Breaking Bad and Breaking Through, Managing and Treating Patients with Meth Mouth.
I really love that title. Thank you so much for being here and sharing with us today. Now, before we go, is there anything we haven't said that would be important for the potential attendee to know about this workshop or how it can help them?
I think it's really going to really be perfect for, all dental practitioners, but especially those who feel that sense of frustration of really, once again, really feeling challenged, seeing treatment being very unsuccessful, feeling that patient walked out the door and they just missed that opportunity to help. And
Yeah,
I'm here to help you know how to help the patients who are in your practice. So I look forward to the attendance and the participation and us doing a deep dive.
that sounds like such a great opportunity. Thank you. Thank you so much, Ronnie, for
You're
being here and
welcome.
sharing today. I hope you all will check it out. drronnibrown.com, DRRONNI Brown, BROWN.com. Underneath the seminars tab, you'll find Breaking Bad, Breaking Through. Anything we're going to email you, your email, best email would be
It's going to be Ronnie at drronnibrown.com.
excellent. And on that note, everybody be well, take good care of yourself, and we'll see you soon.
Bye.
Bye.